Good morning, Amanda.
Thank you for agreeing to talk to us again. You gave a really helpful talk about wellbeing and fertility treatment to the Law Society Wellbeing Conference. And what we wanted to do for colleagues and for clients or potential clients who might be thinking about fertility treatment, to just have a chat with you about the wellbeing considerations around treatment and what people can maybe do to just get themselves informed about the medical side, the wellbeing side, and the legal side. So, as you know, I'm particularly interested in family creation. Do you want to just say a wee bit about how people like yourselves can help people create families?
Okay, so basically, first of all, fertility should be a natural thing and it should happen naturally. And when it doesn't happen naturally, it becomes hugely stressful. So one of the things that people can do just generally is try and reduce that stress as much as possible, just for their own well-being. There's no evidence per se that stress affects your fertility, but just for your general well-being, that's got to be a good thing. And there's a wealth of data on that. But from the point of view of creating a family, if you are a heterosexual couple, then you've got eggs from the woman and sperm from the man. And then depending on the quality of the sperm, whether that's just IVF treatment, where you mix the sperm with the eggs, or whether it's ICSI, where you inject sperm into each mature egg. So that's one option. If you are a single woman or a woman in a same-sex relationship, then obviously you need donor sperm. And therein lies a bit of a problem because in the UK, we have quite a lack of donor sperm. So for us, for instance, we have a small sperm bank, but it's not a huge choice of sperm donors. And the reason for the problem in the UK is that donors are no longer anonymous to any child who was born when that child is 18 or 16 if they get married at the age of 16. So that puts men being off donors in the first place, thinking that someone could walk up the garden path in 18 years' time, sort of thing. So we bring in a lot of sperm from European sperm banks. There's a couple in Copenhagen, the European Sperm Bank and Cryos International. These are commonly used overseas European sperm banks, but the same laws apply. The donors in Denmark know that if any sperm comes to the UK, when that child is 18, he or she has a legal right to choose them. So even there in, say, European Sperm Bank, there's maybe 200 donors, but there's only about 10, 15% of them that actually agree their sperm be brought into the UK for those same reasons. So, but if you're a single woman or a same-sex female couple, then you can use donor sperm. And then, of course, if you need surrogacy, so that the commonest reasons would be, if it's a heterosexual couple, it would be the woman, either she can't carry a pregnancy for some medical reason, pregnancy would be contraindicated for health reasons, or she's had a hysterectomy, that kind of thing. So that's kind of obvious. So they would need surrogacy. Or for same-sex male couples, of course, they need donor eggs and they need a surrogate to carry the pregnancy as well. And the laws on surrogacy are really quite complex, and that's really where lawyers versed with surrogacy laws come into their own, because that's a whole minefield. There is a Law Society commission thing going on. You guys know more about that than me, about how consultation, I think, about how to change the laws, because at the moment, what I say to couples considering surrogacy is that all the ACEs are held by the surrogate. For pregnancy, if the surrogate says, I'm keeping the baby, she gets to keep the baby, because that's the law. And I think the Law Society Commission is trying and make that a bit more balanced. But we'll see what happens with that. But I've certainly had some input into that in the past. So these are essentially the options for the patient. And then it's a case of, how do you progress that? The other aspect of it is about particularly the woman's age, how that has an impact on egg quality. And so as you get older, you're more likely to need donor eggs to have a baby, because your eggs are the age you're at, And that then has an impact on the quality of those eggs and the risks of things like miscarriage, Down syndrome, and so forth. So that's just the kind of, so there's donor eggs, particularly as you get older.
And it does all sound just that there are lovely possibilities there in terms of family creation, but also it could be pretty stressful. We know the benefits and the supports that can be offered by people like yourself and all the people around you, and also the reassurance that can be given by legal professionals. Sometimes people will ask us, why come to a clinic? Or are there any particular considerations you think people should be aware of when considering using a clinic, as opposed to maybe asking a friend to donate sperm or finding a website where people are willing to be donors and be matched with people through that?
Yeah. So fertility treatment in the UK is regulated by the Human Fertilisation and Embryology Act 1990, and it's had some amendments as the years have gone by. And if you are, let's say, a sperm donor registered with a registered licensed clinic, you have protection because you're registered as a sperm donor within the Act, the law. And so you can donate, and if a child results from that sperm donation, when that child is 18, sure, he has the legal right to trace, he or she has legal right to trace you. But you, as the sperm donor, have no legal, moral, or financial responsibility to that young person. Whereas if you're doing it in an unregulated way, from an unregulated website or a friend, that child and the couple who have the child with your sperm could actually chase you. You're the father, and you could be pursued for child maintenance and all the things that go with it. And the other side of the coin, of course, is that if you're a couple using an unregulated sperm donor, as it were, the sperm donor is the legal genetic father. He has the right to say, actually, I want to have some say in the upbringing of this child. And I'm not sure, if that's ever been challenged in court kind of thing. It possibly has. But, he would have the legal right to do it because he is the genetic father. And so it's by registering with a clinic, you as a couple who want the baby are actually protecting yourselves as well. So that's really the legal side of it.
Yeah, and I don't think it has been challenged in the courts in Scotland, but it's certainly cropped up a good few times in my practice where people have been worried about a sperm donor having parental rights and responsibilities and what they mean, and they're fairly extensive rights and responsibilities, I guess. So it's certainly worth being well advised. What do you think people can do to help themselves maintain their well-being during treatment? Are there any practical hints and tips you could give people?
Yeah, what we do is, I suppose, if you like, it's wholly unnatural, and it's not how it should be. You should be getting pregnant naturally. So it becomes incredibly stressful for the couple, the patient, whether it's just single woman, the patient. And so you want to, I say to patients, you want to try and maintain as much normality as you possibly can. I encourage patients to continue to work throughout treatment. In that 2-week wait, when they're waiting for the outcome, taking time off work, using up your annual leave really isn't helpful. It's not going to increase the chances. And all that happens is you're sitting at home kicking your heels and you're worrying about what's going on inside your tummy. And so you try and be as normal as you can. And if you're at work, you're good at your job, and you're focused on your job, it's taking your mind off something that you have no control over anyway. So try and maintain as much normality as you can. Lead a sensible lifestyle through all of this. A good amount of rest. Too much sleep is a bad thing. Too little sleep is definitely a bad thing. Smoking, alcohol. Smoking is a baddie. Alcohol, everything in moderation from that point of view is my motto. So the odd glass of wine, personally, I have no issue with. And then exercise. I think there's a wealth of data to show that exercise reduces stress and makes your life just more, but just makes life easier for you, really. I enjoy exercise. If I don't exercise, I get pretty stressed about it. And likewise, just some exercise. If you're not used to exercise, gentle exercise. But, don't suddenly go start trying to run marathons if you're not used to exercise, purely because I've said you should do some exercise kind of thing. So you want to, lead a sensible life, basically, and try not to let the fertility treatment side of things take over everything else that you do. That's probably the most important thing I can say.
That's good advice. Well, thank you for talking to us again, and I'm sure people will find that hugely helpful. So, yeah, thanks very much.
All right. You're very welcome.